Hi, if you are having persistent low back pain, and that is low back pain that comes and goes, it can be within weeks or it can be within years, then you're not going to want to miss out on the information I'm going to tell you about the 3 signs of persistent low back pain. And believe it or not, there's a lot you can do about this before things get worse for you. Hi, my name is Michael Ricciuto. I'm the physical therapist at Physical Therapy Now, and we've been treating low back pain in our patients for over 20 years. We've seen a lot of different people in a lot of different conditions. A lot of them have a common thread. One of the threads are that you have this low back pain and you've been waiting too long to try something naturally to cure it. You know, it takes a lifestyle and a habit to then get better from a condition. And if you don't do something about a certain condition, then you can't expect things to just get better. So that's one common thread that we see with our low back pain patients. But let's take a look at some of the signs of persistent low back pain. The first sign that you are having persistent low back pain is if you are repetitively bending and having pain in the low back, or worse, symptoms that are going down your leg, the back of your legs, commonly with the sciatic nerve, of tingling, numbness, that sort of thing. So if you're bending and you're moving and you are in pain and also restricted in your motion, then you are most likely having a persistent low back pain episode. Generally, this pain decreases, maybe your mobility increases, but there is an underlying problem that will not allow you to recover fully. You're going to return to this condition most likely because the source of this pain has not been addressed. The second sign that you may be having persistent low back pain is increased periods where you're sitting or you're standing that precipitates low back pain symptoms. A lot of our patients will come to us and say, I can only stand for 10 minutes, 5 minutes. Some people will say, I can stand and I can walk, but when I sit, I immediately have symptoms. This is a sign that there's something going on in the low back and it needs to be evaluated and treated. The third sign that someone is having persistent low back pain is during exercise. Increased energy into the system will create a situation where your lumbar spine is capable of doing the everyday activities, but then when you increase energy into the system, what ends up happening is your low back pain has a deficit to it. So any type of exercise is exacerbating the conditions, but otherwise you're fine. This is not a good thing and this is not normal. Well, there you have it. There are 3 signs that you may be having persistent low back pain. If you are having signs and symptoms of low back pain, the source of the pain has to be addressed. If you would like more information on how that can be helped, we are certainly glad to help you out. You can go to www.physicaltherapynow.net, or you can call our office at 412-794-8352 to discuss your condition. Remember, low back pain is treated on an individual basis, meaning there's no one-time thing or one thing that's going to help you as opposed to your neighbor. It's very specific and requires a very specific plan of action for you to get better. So in saying that, I hope you've gotten a lot out of this video and hope to see you again. Thank you. Have a great day.